Hi, this is Megan Jarvis, and this is my evidence-based practice proposal. The question is, are OBGYN nurses exhibiting the appropriate knowledge regarding postpartum depression, and what are the effective interventions being offered? The purpose of this evidence-based practice proposal is to highlight the importance of education for nurses to be able to care for this patient population. Patients are at risk for postpartum depression during the first year of delivery, and there are even higher rates that occur within the first 3 to 6 months after delivery. The cause of postpartum depression is still unknown. However, there are factors relating to it. This includes lower social economic status, lack of support systems, changes in family dynamics, having a history of depression prior to pregnancy, initial shift change in hormones after giving birth, or any other stressors that occur in someone's life. Screenings, identification, and interventions are all crucial components, and patients need to rely on healthcare professionals to provide appropriate knowledge and care for their diagnosis. There are many sources of literature out there regarding education and interventions on the topic of postpartum depression. We first must acknowledge that there are knowledge deficits in nurses caring for postpartum depression. An example is found in one study. About 83.1% of nurses were unaware of postpartum depression scales or screening tools in their country, Saudi Arabia. Most of the population have low confidence regarding educating patients on this topic. The need for education is clearly present amongst many literature. Education starts with undergrad nursing programs. One study compared nursing programs as well as nurses working in OB. They provided an online education model to the group of participants, including causes, signs, symptoms, prevalence, use of the Edinburgh postnatal depression scale, barriers, interventions, and outcomes. Nursing interventions include teaching the mother of self-care, monitoring postpartum depression at home after discharge. This module taught nurses how to empower a woman to seek help and eliminate the stigma of the diagnosis. The module was interactive, containing videos, which help nurses gain confidence. The overall study results were positive, but also indicated the need for education amongst nursing students and nurses in maternal health. Nurses must understand that their screenings are crucial to the part of diagnosing postpartum depression. They must be able to screen patients and identify who is at risk. Screening can be prior to discharge, readmissions in the emergency room, childcare visits, or even postpartum visits. However, there is a lack in postpartum visits after, as the care shifts from the mom to the baby. This can also be due to the lack of transportation, lack of childcare, lack of time, recognitions of symptoms, or fear or the stigma of postpartum depression. Nurses aren't able to screen women who are at risk. Therefore, increasing the use of mobile screenings can provide confidentiality and convenience for patients who are at home. The goal is to provide accessible treatment and decrease the risks of postpartum depression and its effects. As technology has become more prevalent with the use of telehealth and telescreenings, this should be no problem implementing in healthcare. Nurses need to be aware of different types of treatments besides drug administration to manage postpartum depression. Alternative therapies include use of doula support after pregnancy, acupuncture, yoga, aromatherapy, and mindfulness. The goal is to review these interventions and provide support in education and referrals prior to discharge. A study was shown that women maintain positive with this diagnosis after discharge and often seek help when referrals and education are provided beforehand. Another important intervention nurses need to exhibit is sleep quality, implementing better sleep quality. A study also showed about 77.4% of participants reported the lack of interest of OB nurses having with patient sleep schedule. Sleep correlates with patient's depressive symptoms, so it's important to provide sleep interventions such as changing positions, environment, promoting comfortable clothes to sleep in, and creating a sleep schedules. The aim of this proposed evidence-based practice is to propose change into the nursing practice within acute care facility. What are the requirements for the proposed change? First, we must assess the nurse's knowledge prior to the intervention. Nurses will be giving a questionnaire prior to the intervention on their basic knowledge and competence. Then the intervention will be provided in person or online. A 30-minute PowerPoint will be providing with interventions that nurses can offer patients, as well as a general information about postpartum depression, the appropriate screening tools, and there will be 10 minutes for questions provided at the end. A post questionnaire will be provided to nurses regarding the same material they were asked on the first questionnaire regarding knowledge and competence. This is a randomized control trial, so their participants will be dividing into two groups. One group will contain the intervention, and the other one will just fill out the first questionnaire on their basic knowledge. The IMA model is important for the evidence-based practice proposed change because it contains steps in order to establish into practice. First step is to identify the triggers in practice. There are increased rates in the nursing in postpartum depression. A study was done concluded that there was an overall increase from 2010 to 2021 in postpartum depression. White women increased from 13.5 to 21.8%, and Black women increased from 9.2 to 22% in postpartum depression. Next, we must provide enough evidence for the practice to change. Providing enough strong evidence within the intervention by providing an educational PowerPoint that promotes confidence, as well as enough material to promote change. And lastly, we must establish if the intervention is appropriate to adapt into practice. At the end of this study, nurses should show positive results after taking the post questionnaire. If there's positive change, it's appropriate to adapt into practice. If there is no positive change, we must reconsider the intervention as well as the study and the evidence. Recruiting patients should be easy, as well as recruiting them through the acute care setting, through in-services, as well as emails and posters throughout the setting. This can include any new grads with 6 months experience to experienced RNs of 30 years. This study will exclude any nurse who is not working in OB or has direct care with patients of postpartum. This also will exclude any new grad with less than 6 months experience because they have no experience working with this type of population. The sample size will include 25 to 100 participants. The more participants, the more evidence we will collect to promote change of the intervention into practice. And of course, ethical considerations are considered. Patients are educated about the study prior to participating and can decline or drop at any time. They also will sign a consent that they will not be harmed in this study, as well as benefited. They will be benefited. The proposed setting will be an inpatient setting at a teaching hospital in the Northeast of the United States. Inpatient floors must include direct nursing cares with postpartum patients. This can include emergency department or postpartum units in the hospital. Although the emergency room is not specific to OB patients, nurses experience with any postpartum patient that comes in the emergency room can complete this study. But mainly postpartum floors will include 2 floors with 30 beds on each floor. There is no specific setting where nurses have to complete the study. If they are able to complete the study through their phone or work emails, this allows nurses to access with their busy schedule. Data will be collected through questionnaires. A demographic questionnaire will be filled out based on their age, gender, years of experience, as well as other demographic information. Data will also be collected through the questionnaires, the prior, pre, and post questionnaire. These results will be analyzed later throughout the study. The overall outcomes of the study should indicate positive change. Nurses should feel more confident with interventions as well as screenings and the overall basis of postpartum depression. The group that didn't have the control intervention should just show the basic intervention. There should be no change within their results, but there should be overall change and positive results with the intervention group. How is this significant to nursing? Nurses care for patients with postpartum depressions every day working in OB. Educating our nurses in practice can establish competent and quality of care. Although postpartum depression cannot be cured, we can manage these symptoms through establishing significant information. We can also lower the risk of poor outcomes and mortality with the infant or the mother. The proposed change is derived from research based on education, screenings, interventions, and management. The goal of the proposed change will help nurses become more confident and competent. Effective outcomes will be translated into practice and allow quality care for patients experiencing postpartum depression. Adapting this change into practice, nurses will be eager to learn more about how to care for patients with quality and how to feel more confident in nursing. Policies will be created regarding care for postpartum depression, ensuring that in establishing education, mandating education for all healthcare facilities, and competencies that will be held yearly. Promoting evidence-based interventions into practice as well, teaching our nurses that to offer interventions that have been used throughout the practice with the evidence base. For example, the use of mobile screening tools will be used. Our overall goal is to eliminate symptoms of postpartum depression and provide as a support system for patients and to eliminate the stigma of postpartum depression. Here are my references. Thank you.